Hello everyone, my name is Dr. Ferghal Armstrong and welcome to Cracking Addiction. And today we're going to be discussing lifestyle interventions. In particular, we're going to be talking about the fingers. So remember, the 6 pillars of lifestyle intervention are the feet, the fork, the fingers, sleep, stress management, and social connection. So it's F for fingers. And what does that actually mean? Well, it really refers to tobacco abstinence, which then has, by extension, refers to, all things substance use. So abstinence. But why are we even talking about this? Well, we have to understand that recent guidelines in the AOD space are now beginning to introduce the concept of lifestyle medicine. So, as I've said before in previous episodes, the turning point guidelines for withdrawal medicine, they suggest that withdrawal presents an opportunity to promote harm reduction via the provision of information and education about safer AOD use and practices. This may include a reduction in drug consumption and safer means of drug administration and lifestyle improvements. The New South Wales Management of Withdrawal from Alcohol and Other Drugs Handbook in section 2.1 states, withdrawal presents an opportunity to promote harm reduction via lifestyle improvement. And in section 10.6.1 suggests, also provide general lifestyle advice, re exercise and nutrition to reduce impacts of long-term opioid use. So we're beginning to see lifestyle interventions recommended in the AOD guidelines. What is more obvious, however, is the prominence that is given to lifestyle medicine within the mood disorders clinical practice guidelines, where they emphasize the foundational aspect and role of lifestyle interventions. And moreover, they give very detailed advice specifically to a range of lifestyle interventions. That gives us the idea that there are a number of pillars of lifestyle medicine, which I refer to as the 6 pillars of lifestyle medicine, the 3 F's and the 3 S's. So we have the feet, the fork, the fingers, sleep, stress management, and social connection. So back to the fingers, smoking and alcohol and other drugs. So let's look at smoking in the context of AOD. Well, all doctors would always say that you must stop smoking. But let's look at it in terms of the AOD space. So we know that cigarette smoking is much more common among patients with mood disorders compared with the general population. We know it's also more common in patients presenting for AOD care. We also know that people with mood disorders and AOD problems tend to smoke more heavily than the general population of smokers. So smoking is more common, and people who smoke more heavily if they're affected in this space. We also know that smoking interferes with the metabolism of many antidepressant and antipsychotic medication. And whilst that's a problem in itself, we also know that smoking is one of the main reasons why the prognosis for people with mood disorders is so low. It's one of the reasons why there is a decreased life expectancy. So whilst it's very common, it should not in any way be trivialized, and we need to emphasize the role of smoking cessation in care for people with AOD problems and also for mood disorders. There's another issue that we need to address, and that is this idea that patients are coming in for withdrawal management, so they're coming off something like cannabis or alcohol or methamphetamine. Surely it's an act of kindness to let them to continue to smoke. And I think that's one of the reasons why there still exist smoking rehabilitation units or smoking withdrawal units. I believe that actually we should not be encouraging patients to smoke during withdrawal, because there is evidence to suggest that actually smoking cessation improves the success of detox and improves the success of rehabilitation. And smoking cessation is actually associated with an amelioration of anxiety. It relieves anxiety. So I am aware that a lot of smokers will smoke to to relieve stress because they're feeling stressed and anxious, therefore they'll have a cigarette. But actually we know that in the long term, smoking cessation improves anxiety. And then there's another issue about smoking, and that's, well, can you actually give people who are potentially quite sick with mental health disorders, can you actually give them the biggest or the main drugs for smoking cessation, and I'm talking about, in this case, varenicline. Well, because of the EAGLES study, it was actually carried out in Australia, it was found that actually you can safely give varenicline to people with major depression and with also psychosis. That does not absolve one of the need to monitor mental state very closely, but it's certainly not contraindicated. And indeed, as a result of the results of the EAGLES study, the Maudsley guidelines were changed to include varenicline as a therapeutic option for smoking cessation in patients with depression and schizophrenia. So for those reasons, I believe that we should be actively addressing smoking cessation in all our smoking clients, especially in the AOD space and especially in withdrawal units. Now, let's glance on alcohol. I just want to make a few general comments about alcohol. We're talking about lifestyle improvement. We're talking about the 6 pillars of lifestyle medicine. So in this context, we need to understand where alcohol sits. So let's remind ourselves that in Australia, one standard drink is 10 grams of alcohol. And if we look at a full-strength beer, at a bottle of beer at 375 mils, that's roughly 1.4 standard drinks. A glass of red wine at 150 mils is 1.6 standard drinks. A glass of white wine at 150 mils is 1.4 standard drinks. A glass of port, 60 mils, is 0.9 standard drinks. And a glass or a shot of spirits at 30 mils is 1 standard drink. So from that, I find it quite interesting that actually white wine has got a slightly lower alcohol content than red wine. But when we think about the alcohol guidelines, remember the 10-4 rule. So really, to reduce the risk of harm from alcohol-related diseases or injury, healthy men and women, and I emphasize healthy men and women should drink no more than 10 standard drinks a week and no more than 4 standard drinks in any one day. So going back to the alcohol content of a standard drink, so we can actually see that if you're thinking about bottles of beer, so 375 ml bottle of beer, that's 1.4 standard drinks. So you're probably only going to be able to drink 7 standard beers a week to stay beneath that 10 standards a week regime. It's not 10 bottles of beer, it's only about 7 bottles of beer. That, for some people, can seem quite restrictive. But wait till you see the Canadian guidelines. So the Canadian guidelines are now beginning to recognize the continuum that exists between alcohol consumption and harm and ill health. And so what they've said is that not drinking at all, abstinence, has benefits such as better health and better sleep. And they say that 2 standard drinks or less per week means that you are likely to avoid alcohol-related consequences for yourself or others. Then they say that at 3 to 6 standard drinks per week, your risk of developing several types of cancer, including breast and colon cancer, increases. And then they say at 7 standard drinks a week or more, your risk of heart disease or stroke increases significantly. So there we have the example of an escalating amount of alcohol being associated with escalating harms. If you can demonstrate a dose-response association, you're almost there to demonstrating causality. Now, it's quite confusing what a standard drink is. I mean, let's go back to the Australian definition of a standard drink versus the Canadian definition of a standard drink. So in Australia, we define a standard drink as 10 grams of alcohol. In North America, they define a standard drink as 14 grams of alcohol. Now, in the US, the alcohol guidelines have a gender variation. So they say that you should, as a man, be drinking no more than 2 standard drinks a day, and as a woman, no more than 1 standard drink a day. And remember, each standard drink is 14 grams of alcohol. So for men, 2 standard drinks a day for a week is 14 standard drinks. Times that by 14 grams of alcohol, you've got 196 grams of alcohol a week, which is almost double that which is recommended in Australia. So there is a wide variety and variation in the in the guidelines around standard drinks. So then that leads us to the next question of how much do you actually have to drink to start becoming dependent on alcohol? And so really what we're seeing is that for women, 6 standard drinks, now I'm talking about Australian standard drinks, 6 standard drinks a day, that's 60 grams a day, for 2 weeks is probably enough for you to start getting dependent on alcohol and thereby starting to develop withdrawal symptoms when you stop. And for men, that goes up to 8 standard drinks daily for 2 weeks. We then need to start thinking about alcohol-related diseases. Now, the Canadian guidelines alluded to those in their guidelines, but let's look at particularly heavy drinking. Now, in this particular study the results of which I'm going to quote you, heavy drinking was defined over 10 years as more than 10 standard drinks per day for men and more than 6 standard drinks a day for women. And they find that caused 54% of all cases of cirrhosis, 44% of all cases of pancreatitis, 41% of all cases of oral cavity cancer, and 10% of strokes. And if we look at cancer in particular, we can actually see that there are certain cancers that you don't have a threshold for an elevated incidence of. So really what that means is abstinence really is the best choice for certain types of cancer. And that includes oropharyngeal cancer, breast cancer, and esophageal cancer. And I should actually point out that the risk of cancer of the oropharynx, i.e. the head and neck, is dramatically increased if you smoke and drink at the same time. It's the combination that really exacerbates your risk. But then there are other cancers that do have a threshold. And so really what we know is that if you're drinking more than 40 grams of alcohol per day, and that's 4 Australian standard drinks, then you increase the incidence of the following. So you increase the incidence of pancreatic cancer, liver cancer, ovarian cancer, and colon cancer. And when we think about the harms of alcohol on a more global, in a more global way, of course, we must not ignore the fact that alcohol causes liver disease, alcohol causes heart disease, and also alcohol causes gonadal problems as well. Really, every system in the body can be adversely impacted by alcohol. So on that sweet note, that's all I'm going to say about alcohol in the context of lifestyle medicine. My name is Dr. Ferghal Armstrong. Thanks for watching, and this has been Cracking Addiction.